the friction reduction sheet to pull them over, or I can even use the
Turning a patient on its side.
I call it a linen saver.
Right.
Chucks. Chucks are really paper with plastic backing.
Yep.
And you don't want to, you can use
Rip
chucks for a real short time, but never leave a patient on chucks because they will blister on it. Okay, so what I'll do is, since he can't move or can't help me, I'll bring his ankles over closer to me, like so. Then I'll bring the pillow over a little bit, and I will slide him towards me. So he's on this side of the bed. So now when I turn him, he'll be turned in the middle of the bed. So
I'm gonna do this to my husband when he honks the bed.
I'm just gonna lift him up and over.
Just kick my husband.
And
I'm gonna do
then
this.
we'll hold him like that.
That's what we do too.
Okay, now see, I want to keep him covered up, right? And it's easier to do with real people. Human beings, I guess that's what I should say.
It's a little slippery.
Yes, they are slippery and they're very stiff. So I'm going to take my towel, which is right here.
Excuse me.
Before I even start rubbing, I am observing his back. Everywhere on his back. Because the part that's in contact with the bed most is the most likely to have a skin breakdown.
Right.
What am I looking for?
Red spots.
Red spots or white spots?
Or white spots.
If I see a red or white spot, am I going to rub on it?
You
No.
No, because that damages tissue further and makes the damage worse. But I will identify where it is. When I chart it, I will use something that's easy for everybody, tennis ball size, quarter size, dime size, something like that that's easy, or you can measure it if you want to.
Upper right extra.
But usually I don't have a ruler when I need one.
Right.
So I just do something softball size. Everybody knows what size a softball is. Okay. All right. So I've got that. Then I take my cloth, make my mitt, and I'm trying to hurry here. So I start at the top and I do circular motions like that while I'm washing and dry them off. Then I'm down to the bottom, and I want to make sure, I don't care how you do this on their bottom, so long as your strokes end up where the rectum is, okay? So I like to go like this, and then down the anal crease, down this way under now I'm forgetting what it is. I'm trying to treat y'all. Under the gluteus maximus, but it has another name, and I'm trying to think of it, but that's all right. You want to go down, and the last stroke is down the anal crease to the rectum. And blot dry, and then I can offer them a back rub. You use a little bit of lotion. There's two motions that it talks about, effleurage and petrifage. All those is just rubbing the back. Don't worry about being an expert masseuse. The important thing to remember, don't press on the spine. Don't put pressure on the scapula, because that's uncomfortable. You can rub the parts where the muscle is, but don't rub the bones. Okay, that hurts. All right, so I've done that. Now, I'm going to change my linens. I'm going to get my dirty stuff out of the way.
Mine y'all's way. Okay.
Yes, thank you.
I'm trying to practice now so that
Yes, I'm glad you do that. And we'll be watching for that. When you're doing anything, be sure you keep your patient covered, because we want you to get into the habit of doing that. So I'm going to lift your head up, and I move this pillow over a little bit, and now I can loosen my linens down here like so. And I made a bedroll, and I'm going to show y'all how to make one if you want to do it too. But I'm going to roll up the dirty linens as tightly as I can. Move this heel up a little bit. Try not to get your other linen stuck in it. There you go. Roll it up really, really tight. And then I'm going to uncover him so they can see what I'm doing.
you're okay.
I thought about that after.
No, that was
You're being good. You're being good. Now I tuck it under his hip so that holds it in place, okay? I'm going to take off my gloves because these are clean sheets I'm putting on. And you do not have to wear gloves to change linens if the linens aren't soiled. If they're soiled, then you want to wear gloves. So here's my bedroll. Open it up here. You do not have to do this. This is my own thing. But a CA taught it to me years ago, and I love it.
Yep.
So I'm going to tuck the new ones, the clean ones, underneath the dirty, like that. And then I unroll it. And I put this together in a hurry. I might have gotten a little off.
That's all right. Got the concept. That's exactly how it's
Got
One
the
thing, if you don't do a bedroll, you need to put your linen in order. That's
Yes.
time management.
Mhm.
So that when you could lay your linen at the end of the bed, but have it in order of what you're gonna utilize first, and this way you just have to reach and pick, reach
Right.
and pick. It's always time management, but the
So,
bedroll is
You
faster.
want the top, you want bottom sheet, the fitted sheet, then you want friction reduction sheet, and then you want the linen saver. And you have another stack with the top sheet and the pillowcase, okay? All right, so now I'm gonna let him roll over it, and I don't want him to scoot. If you don't mind coming on this side.
And you're gonna make your bed this way, whether it's occupied or unoccupied.
There you go. I should have pulled that rail up before I walked away.
You mean the order?
Yeah, they're saying
Meaning
both
that
sides.
you're gonna make one side of the
Yeah,
bed
go ahead,
first
put
and
it
then come to the other side.
Right.
Yeah.
Now, you can turn that way a little bit.
The bedroll used to say was plenty.
Here's my
time.
dirty linens. And then I put them, sorry, I'm gonna use your chair, put them on a linen hamper. Never put them on the floor.
Right.
Don't put them on the overbed table, anything that's dirty. And now I can unroll my sheet. I hate fitted sheets. They don't stay on, they're supposed to make it easier for us, but they don't stay on any better than flat sheets. And flat sheets, man, you can make them so tight it feels good.
Military cover.
All right, now he can roll back over on his back. And he's in place. Now, I'm gonna change that top sheet. And I have my other sheet right here. So on this one, this is the magic trick. I'm gonna open this up so I can see where the top is and where the bottom is. And I apologize for these sheets. This is one of them. All the edges look like this, so they don't have a top or bottom like you're used to seeing.
Tag at the bottom.
But there's a certain way that we put sheets on the bed, the top sheet and the blanket.
What do you think the safety issues in making a bed? What would be the safety issue here?
Keeping it clean.
Hmm?
Patients getting tangled up.
I can't hear you.
If the patient gets tangled up in the sheets or the blanket.
Well, it's more of preventing, you always want to prevent infection and promote safety. So you always want to keep the seams away from the patient to cause abrasion to their skin. You never want to fluff the linen.
Yeah, we talked about
Got
flopping
that.
it around.
So you don't spread microorganisms.
So
okay?
can y'all see, this is the rough edge
Yes.
and this is the smooth edge. Could you see rough edge where the seam is? It's not very rough, but when a patient's laying on it, after a while, it can cause skin breakdown. We only want this smooth edge to come into contact with them. So I'm gonna put it on the bed where the rough edge is up. And then I'm gonna ask Mr. Jones, I forgot, I do need you, or somebody just to hold the top sheet. I'm gonna ask my patient to hold the top of it. And then I reach underneath, and I can pull the old sheet out from under him without uncovering.
If the patient is ambulatory, do you just ask them to get out of the bed so you can make it, or?
Yes, if they're
Always
ambulatory,
good.
you definitely want them to get out of bed.
Always.
It's a lot easier to make an unoccupied bed than an occupied bed. Much easier. This is another linen hamper. Okay. Now, I've got this. And I want to make sure I don't have too much hanging over. And come down here. And go ahead and pull the blanket out from underneath there because you want to redo that now. Okay. So I can take my blanket.
Are you tucking that sheet under the bed, or do you just leave it?
Yes, I'm gonna tuck it under.
Okay.
Yes, you're
Okay.
right. But I wanted to make sure my blanket was on here right. Yes. A lot of these are not on right, so you need to look at them. And on the blankets, the lines go up and down, so that helps you know which way they go. But I've got it up like this. Now I'm gonna smooth all this out down here. Come on, this works. You're fine.
In a real life situation, would it matter if the blanket touched the floor?
Yes, you
Yes.
don't, anything that touches the floor is considered dirty.
Okay.
And I think I did let some of it touch the floor, and I'm
What
glad
now?
you caught that.
What'd you say?
That's all right. I mean, okay, now, this is how we tuck it in. You're gonna grab the mattress, lift it up, pull
So you mean
everything
not touch the
underneath so it's smooth under there,
Mhm.
lay it down.
When I
Like
was
a
trying, but
miter?
that was years ago.
Yes.
When I was done. Yeah.
and there's a
You can do that
little
right now.
bar down here. That's there to help keep the mattress from sliding down too far. So you want the mattress on the inside of it. Now, I'm gonna make a mitered corner. So I come down to about where their knee is. I lift this up just like that. You don't have to lift it up this high, but I'm doing it so you can see. There's a big triangle here. Lay it down. Tuck under this way.
Yep. It's military.
And tuck under with your hands like this, or the thing will take your knuckles off.
Yeah.
Then you lay it down like that.
So you
And there's a
grab me
nice
present.
mitered
Right.
corner.
So
Okay?
they still do
One other thing I gotta do, it's okay, it takes practice.
it.
One other thing I have to do is, you see how his toes are kind of poking up here? If I left that like that, the ends of his toes would start breaking down, and he could also call what they call foot